Hey guys, my name is Abdullah Jata. So I'm a final year medical student at the Latin America School of Medicine. If this is the first time you're joining my channel, please do subscribe, share the video, and please do comment. It helps me a lot. How? Because one of my goals here is to be able to give, but the other goal that I have is to be able to receive from you all. So I do realize a good number of my followers, my subscribers, are either medical students or medical doctors themselves. So please, I would like to hear from you all geniuses out there. All right. So, in fact, today's topic, viral load, HIV viral load. If I had a suggestion from one of my good friends, I consider her as one of my biggest friends out here. So, shout out to her. Thank you so very much for your suggestions, and that's why I always emphasize the importance of you reaching out to me, critiquing. I like critiques, so please do send out to me what you think about the contents. So without much ado, let's get into it. Yeah. So viral load in simple parlance. All right. So what when you say what is viral load, I would say in simple parlance, basically it's the amount of HIV that is found in your blood. So I've gone through the pathophysiology of HIV. Please do watch it if you haven't. And also, I've treated a little bit on the anti some of the antiretroviral drugs that I use against the disease. So please, you can go back to such videos if you haven't already. So getting back to our thing, our viral load, like I said, it's basically in simple parlance is the amount of HIV in your blood that we measure, that we get through different testing methods, such as the PCR testing, the PCR technique. All right. So the amount of HIV. I mean, how is this helpful to us? This is very much helpful to us, as you can see on the graph, because knowing your viral load, can help us to be able to monitor the patient's HIV disease, decide when to start even the treatment, and of course to be able to determine whether or not the antiretroviral drugs that we are giving our patients are working. All right. So having, as you can see on this graph, having a low viral load is obviously gonna be the goal of every sane medical doctor. So if you are a sane medical doctor, you want the viral load of your patient to be undetectable. Undetectable indicates that the virus is very much inactive. But on the other hand, on the contrary side, if you have a very high viral load, then that means the virus is very much active in the patient. So I mean, this is also very important because as today earlier today when I was doing my own call at the hospital, I was going through a very important studies that was done by Up to Date and other partners. I think it's a landmark study, partner one of studies, where you have about 58,000 plus participants in the studies, and basically the evidence shows that the likelihood of passing on HIV, it's linked to the amount of the virus in one's blood. So basically, what happens is in the studies there were instances of sexual intercourse without any protective measures, without any condom whatsoever, where one partner was HIV positive and the other was HIV negative, and there were like zero cases of HIV transmission in couples where HIV positive partner was on effective antiretroviral therapy. So if you're taking your drugs on time, you're adhering to the prescriptions, whatever given to you as a HIV patient, then the likelihood of you passing the disease, if your viral load is undetectable, is very low. This does not mean in any way, shape, or form that you should not be careful as a HIV patient. All right, if you're HIV positive, you need to take all of the measures very seriously. All right. So about this, let me explain to you quickly why we draw the blood of the patient. You guys know very well that we have something called gut-associated lymphoid tissue, because there is one thing that we have to remember. about the HIV, and that is the fact that the largest reservoir of HIV is basically found here. We call it the gut associated lymphoid tissue. Remember also that we here, that's where we have the Peyer's patches. The Peyer's patches basically are cells that are found in the mucosa, if you remember, the mucosa and the submucosa of the small intestine. So it contains a lot of CD4, CD8, T cells and B cells. It's basically it's most likely the source of the ongoing replication. If you haven't gone through the HIV pathophysiology, please go through it. Even though I didn't really touch on the Peyer's patches, but because that's where you have a lot of your CD4 cells and the B cells and T cells is very much the most important place. Is like the reservoir of the replication of the virus itself. So because as medical doctors, we are not able to, we can't just, you know, bust through your stomach and get into your gut associated lymphoid tissue area. So what we can do is we can just draw your blood and measure it by using PCR technique or some other important or related techniques that we might be able to get the viral load of the patient. All right. So what is this? Basically the results. What do you get? First, you remember that when the patient has been diagnosed, let's go back to our first slide here. When the patient has been diagnosed with HIV, so a HIV patient is positive, basically we need to establish a baseline level. So baseline level here, as you can see, let's take a patient that has recently been diagnosed with HIV. So he's HIV positive for the first time. Let's look at this. We have 35,000 copies per milliliter. Remember, the viral load is measured in copies per milliliter. So let's say if this patient is newly diagnosed and has like 35,000 copies per milliliter of viral load, I mean, that's basically the baseline level of this particular patient. And as time goes on, depending on if the patient is taking antiretroviral drugs on time, and they seeing the doctor and taking all of the treatment measures and so forth, obviously we're going to see the viral load dropping down to the low level, or at some point even undetectable. All right. So the International Association for Antiviral Therapy basically suggests that after you have been diagnosed with HIV and AIDS, 2 to 3 weeks, or sometimes they even say 4 to 8 weeks later, you need to check your viral load. After that, if you start with the antiretroviral therapy, it's between 3 to 6 months. You need to be checking on the viral load. So remember, there is a huge difference between the viral load and the CD4 count. And so the viral load, we expect it to go down. But then the CD4 count, obviously, we expect your CD4 count to go up, because your normal CD4 cells are part of your immune cells, or the viral load is the disease itself. All right. So that's just a vineyard right there. So going back to our results, we have high if you have this is not something concrete, like it's not every book that you consult, you're gonna see something like this, but generally this is acceptable. High is basically about 5,000 to more 10,000 or even more. For example, if you go back to our graph again, as you can see, it's way more than 10,000. It's about that is about 35,000 plus. So 5,000 to 10,000 or more would suggest that the viral load is very, very high, and that means the disease is very much progressing. And if you don't do anything about it, you don't take any treatment, then that means that you are getting yourself into the bottomless chasm of AIDS. Because the acquired immunodeficiency syndrome is kicking in. All right. So this could also, let's say the patient is taking their meds on time, they're adhering to the therapy as prescribed by the medical doctor. It might indicate that the patient has a drug resistance type of HIV, which is possible, which is another topic. So the other thing is the mid-range viral load, which is between 500 to 5,000 copies per milliliter. Like I said, is always measured in copies per milliliter. The low viral load is between 75 to 500 copies per milliliter. And of course, the undetectable, which is a very much an important goal for every doctor, is like between 40. And some books, they even say 20, all right? So 40 to 75 copies per milliliter. So if you have any questions, please let me know in the comment section about the viral load, all right? Gracias. Thank you so very much.